Morning. Just for the benefit of the public, my name is Darren White. I'm the County Dufferin Warden, and I'm with.
Good morning, everyone. I'm Brenda Wagner, and I'm the administrator here at Dufferin Oaks, located in Shelburne.
So good morning, Brenda. How are you doing today?
I'm doing great. Thanks for asking. And how are you?
I am fantastic. Thank you. We've got some questions I wanted to ask you just for by means of a public update for residents of Dufferin County so they can understand what's happening up at the Oaks. But the first one I want to ask you is, how are the two staff members that tested positive for COVID doing?
Thank you very much for asking. So our staff at the home right now are working diligently. They're working around the clock here. We are a 24/7 operation, of course. Everybody that's coming in is healthy, which is great. The two staff members that tested positive are at home and they are recovering and doing well. Thanks for asking.
Excellent. Thank you. So I guess the first question the public would want to know is it safe at Dufferin Oaks?
You know, that's a really good question. And I want to just put it out there right now that we're actually safer here, I feel, than anywhere else. The screening measures that we've put in place, and we put them in now is about 3 weeks ago, really make sure that anybody coming into the home is healthy. So yes, we are very safe here. We kind of joke that we actually are more afraid of everybody else out there than of each other, of course.
Excellent. So why don't you detail some of what you're doing for the safety of the residents and the staff up there?
Okay, so maybe I'll just walk you through as someone that enters the home what they would see. We have a screening area in place. So we have a screener, they're in full PPE. And when you come in through the doors, you're first asked, you're stopped as soon as you come through the door actually, and you're asked a set of questions. And some of the questions that you're asked is, have you experienced a fever? Do you have shortness of breath? Do you have a cough? And those are very common questions that have been asked everywhere. But we're also asking, do you have any muscle aches? Do you have a sore throat? Are you fatigued? We're really trying to drill down to see exactly how you're feeling, even if you have a headache. The other thing that we're doing, of course, is we're taking temperatures. We're taking temperatures of our staff, and then we're also taking twice daily temperatures of all our residents, and that's helping us to really monitor how everyone's doing. We ask staff to start taking their temperature a second time, and again, that's when they're at home, just at the end of the day, just to see how they're doing, because we want to ensure that everybody in this building is safe and healthy.
Well, that's great to hear. So what do you think this is with regards to the impact on the community with regards to COVID-19 and the Oaks?
I think there's a lot of very nervous people in the community right now. We've had a lot of questions. Is it safe to come by? Is it safe to drop off a delivery? I think the perception out there is that we're sick in here. Again, I can't emphasize enough that we just don't want it brought in here, but yes, it is safe to come by here. Absolutely.
Yeah, so for sure, what we're trying to do is keep it out, not keep it in, right?
For sure.
I guess it's important for people to know that. So when you talk at the whole campus up there, is the Mel Lloyd Center considered a separate building, or how is that handled within the greater picture of things?
Yeah, Dufferin Oaks is completely separate. We've locked all entrances that connect the two of us, so it is completely separate. They even have a separate address, to tell you the truth. So yes, the screening measures that are going on at the Oaks have no effect of anything going on over at the Mel Lloyd Center.
Great. Well, it's great to hear all that, Brenda. I mean, I hope it's reassuring to some of our residents, particularly ones that have folks up in the Oaks. And I mean, I can't express enough how much we all appreciate what you guys are doing up there and how important your work is. Is there anything else you'd want to tell the people if you had a 2 minutes or 2 second sound bite to say to get your message across?
2 seconds. Okay, I'm going to have to really narrow this down then. I can't stress enough social distancing, hand washing, staying healthy for everyone out in the public. We're really stressing that with our staff, and we're also doing that with our residents. So we're practicing safe social distancing as much as possible in the home as well. And again, a huge shout out to our staff that are working in healthcare and specifically right now in long-term care. we couldn't do it without them. They're amazing. They show up to work every day with a great attitude, and I'm so proud of them.
Yeah, I know how strongly you feel about that, Brenda, and I think everybody really appreciates that. So let the staff know that we're all behind them, we're all supporting them, and you know, in this tough time as we move forward. And I know yesterday you did say, you know, you're more afraid of people from outside than they should be about the people from inside. And I think that's a great message for people to realize.
Thank you.
Well, thanks. We'll talk to you soon, Brenda, and have a great day. All
Okay.
right. Stay well.
Okay. Take care and you stay healthy.
All right. Bye-bye.
Okay. Bye.